All right, so food. We all love food. Food should be something that's fun and enjoyable for the family. It shouldn't be something that we struggle with within a family. Food is essential to the growth and development of everyone. In children, we expect food to kind of provide the building blocks for their brain growth and for their body growth. And while in everybody, it is providing the supplies that our body uses in order to be able to repair it for the multiple damages that we do to our body and strains that we do to our body on a daily basis. As a physician, the emphasis on food is around us from everywhere. And as a physician, I sit there and spend my entire day talking about trying to increase the quote-unquote good foods in our body while decreasing the quote-unquote bad foods in our body. We look to the USDA, who has set out choosemyplate.gov, where basically it sets out a general ideal and guideline where 50% of our diet should be among the fruits and vegetables, 25% should be lean proteins, and 25% of our diet on average should be the whole grains. This is the ideal. It's what we strive for, but it is not reality. When you have a family full of children, full of parents, some of them can be picky eaters, whether it's the children or the adults. It's what we aim for, but it's not reality. When a family decides to grow by having children, the discussion of food and the emphasis on food starts before your baby's even born. With your OB talking about your choice of whether you're going to feed formula or feed breast milk, and the education of the advantages and disadvantages regarding those start before your child even comes. And then your bundle of joy arrives. Your pediatrician walks into the hospital room, and hopefully the first words out of their mouth is congratulations. But I can bet you from the second set of words that comes out of their mouth focuses on food. So, how's your baby latching? How are they feeding? And every subsequent visit after that time with any provider that you see focuses on how they're feeding, what they're feeding, how long they're feeding, or how much they're feeding, depending on which choice you do, whether it's breast or bottle or combination, and how often they're feeding. Most babies between the day that they're born and when they're less than 6 months will feed somewhere between 8 to 10 times a day. And that's normal. Then your child starts to grow up. And suddenly we're 6 months. We're starting to feed. We're starting to introduce solids. They're starting to sleep through the night. We're slowly trying to transition them from those 8 to 10 meals that they've been eating consistently since the time that they were less than 6 months, to the toddler time of usually on average about 6 to 7 meals a day. You're starting to, in the first 6 months of your life, you've looked to your pediatrician to help guide you as far as how much to feed them. And on average, we could sit here and say most 2-month-old feed about 2 ounces, 4-month-old feed about roughly 4 ounces each feed. Once they hit 6 months and we start introducing solids, that's all gone out the window. We can't provide that information because everyone is different. Introducing solids, it's an art. It's not a science. We sit here and we try to guide you, but the truth is, in the past, traditionally, we've sat here and said, why don't you start with the vegetables, then move on to the fruits, and finally end with the lean proteins. However, it's a tradition. It's not based on science. Now, when I sit down with parents and talk to them about feeding and introducing solids, I basically say, start with the foods that you're familiar with, the ones that you feed your family on a regular basis and eat within your family on a regular basis, so they get used to those foods and those textures. Have fun with introducing solids. There is no wrong way and no right way to do it. Move forward with introducing solids as fast or as slow as your child tolerates it. Everything related to science is out the window when that comes. Typically, between the age of 6 months and 15 months, you still continue to have some control over what your child eats. They will eat when you choose to feed them. They will eat what you choose to feed them for the most part, regardless of what kind of solid. Yeah, occasionally they'll sit here and decline to eat the peas or something to that effect. But for the most part, your child will sit there and eat almost every food that you put into their mouth. They're starting to transition from those 8 to 10 meals a day down to the 6 or 7, but it's a gradual transition. There's no definitive that we can sit here and say, this is the right way to do it. By the time that they're about 15 months, toddlerhood starts to happen. We start to see the toddler eating habits, and these are very frustrating and very difficult for most parents. They decide self-will starts to come into the play. They start to be independent. Their motor development, their fine motor development is improving, where usually between 15 and 18 months, they're sitting here, they're able to put their hand into the bowl, pick up the food, and actually put it in their mouth. They're also starting to play with utensils. They're making a mess everywhere. And those things are normal. Also, toddlers will typically play with their food. They put their hands in it, they splash it around, they smell it, they put it in their mouth, they taste it, they spit it out. These are all normal toddler behaviors that you typically will see. Then, in addition to that, as many of you who may have had toddlers at some point will know, they will have days where they eat nothing. And then the next day or the next day, they're a boa constrictor or a garbage truck, where basically everything you put in front of their plate or in front of them, they will sit there and eat continuously. This is normal. It's okay if they sit there and skip some meals, because they are managing and regulating when they are hungry. Some toddlers also will typically kind of pick at the foods. They'll sit there and kind of take maybe a bite or two, and then maybe they're done. That's okay. That's also developmentally normal for them. Toddlers are very frustrating. We love them. They're cute. Their smiles are there, but they are frustrating. And the most important thing to realize is, just as your before 6-month-old, your 6-month to 15-month-old, they sit there and control exactly how much they eat. We can try to push them, but for the most part, we control when they're eating, what they're choosing to eat, or what their options are, but they just get to determine exactly the quantities that they're choosing to eat. Doesn't matter how much you push a less than 6-month-old, they're only going to eat what they want. Same thing with that 6-month to 15-month-old. If in all honesty, they don't want to eat it, they're gonna, their mouth is gonna lock shut and it is not opening, no matter how many tricks you try. The same thing happens with your toddler. They are continuing to recognize the cues of their bodies in order to control if they're hungry and when they want to eat and if they want to eat. And that is normal. Then your child continues to grow up. Now they're preschool age. Preschool age kids are starting to recognize the outside environment. They're starting to recognize the social cues around them. While modeling, watching parents is important from the day that we start solid foods, it is especially important from the parents at the age of preschool age, because your preschooler is not listening to what they say, what you say. Doesn't matter how much you try, they're not listening to what you say, but they are watching what you do and what you're trying to do as far as eating goes. So modeling it from a parent is very important if you want to establish good eating habits for your child. And yes, that means some picky eaters who are parents sometimes have to sit there and put those green beans in their mouth and smile, even if you want to spit it out and throw it in the garbage. That is true. At this age, we're starting to transition in the preschool age. You're going from those 6 or 7 meals a day down towards the 3 meals that we typically think of and 2 or so snacks. And that just kind of is something like a gradual progression. While they're starting to pick up on social cues, you also may notice that your child suddenly wants to help you with everything. This is when you can start getting them excited about food. They can start helping you with food preparation. Developmentally, if they want to be there when you're cooking, they can take that cup of nuts and dump it into the big bowl that may be in the salad that you're making. Or they can go to the grocery store with you, and if they're interested in different fruits, maybe they can pick out some of the produce and put it in your cart and stuff. Yeah, If you need to, you swap it out, but you let them start to participate to the level that they're interested in doing. This helps get them excited about different foods. It also helps them be more willing to actually try different foods that you may be willing to, that you're trying to prepare at the home and feed them. And they're also, as you're kind of cooking, having them sit there with you on the counter, taste the foods in the different ways, taste them as you're kind of going along so that they see that it does taste different depending on how it's prepared. Your child continues to grow up. Now, suddenly they're school age. Hopefully at this point you've established the eating habits that you want them to pursue and continue to perform as they grow up, because now that we're school age, we're eating at least one meal away at school. You may pack their lunch, but there's nothing that controls whether they are trading at the lunch table, eating half their lunch, eating none of their lunch, or eating all of their lunch. Or maybe they get the school lunch, in which case you have no control over whether they're eating what they're choosing to eat even at lunch. So with this, we kind of have to sit back and kind of realize that we've taught our children to this point. Hopefully those teachings that we've established from the time that they were born to the time when they go to school stick. In addition to that, school-age kids are becoming very aware of the social stigma and the social awareness around at school. So in many times, you will find that kids who may have grown up in families with ethnic backgrounds or vegetarian families will suddenly decide, I don't want to eat what mom packed. I'm not going to eat it. And so they stop eating foods that you have routinely and always fed them at home. That's okay. This is normal. Honestly, I always encourage parents to kind of sit there and kind of push through, continue to serve the foods that you've always served them, that they've always eaten. It's a phase, it will pass. Just kind of continue to support them through it. Enough about the development, about the eating habits. Let's talk about a couple of the psychological aspects that are important regarding feeding and the development of feeding and eating habits within a family. First, I want to talk about the fact that you need to recognize your child from the day that they are born or soon after is pretty much eating what they need to eat in order for their growth and development. So from a parent's perspective, it's letting go. It's letting them feed and eat the quantity that they want. We've done studies that show when parents feed their child filling foods, don't sit there and say, oh, you need to finish the plate, but we let them self-regulate how much they need. They are eating the amount that they need to grow, and it decreases the risk of obesity within a family. In addition to that, we've also done studies on the reverse side, where we kind of look at kids where we use food as a reward or punishment type system, where we're really they get rewarded for finishing their plate, or maybe they get punished for not finishing what was on their plate or not trying something. By doing this, we're teaching our kids to override their innate ability to self-regulate and eat what they need to do. And by doing this, we are creating a habit where we are going to increase in our child the risk of going on to develop obesity. And that is not what any parent would ideally want to see for their child if it's something that we can prevent. Secondly is the concept where we typically think of foods in the sense of good versus bad. So in the reverse psychology world, we naturally go to what's bad for us. When we sit here and think of bad foods, studies show it increases our cravings for certain foods. We really want these foods. We crave the high sugar, the high fat foods, and these are the quote unquote bad foods, but we want them because we're not supposed to have them. Versus the good foods. We sit here, we push the vegetables, we push the good proteins, the chicken and everything, and you kind of push back against it. So by changing our entire thought process and recognizing that all foods have some value in some sort of way or fashion, changing our thought process to maybe our everyday foods and our sometimes foods, and having those around the house. And when the sometimes foods are around the house, not making a big deal of them, not using food as reward system or a treat, and that type of thing kind of will help make it so that maybe our high-fat foods and our high sugar foods are not necessarily, they're not bad foods. They're foods that we can have sometimes, but maybe we don't need them every day. And when we do have them, we have a little bit, but we don't associate it with that good versus bad, which is going to make us sit here and crave it and overdo it. So in summary, as a pediatrician, if you leave here with one thing to remember, it's remembering your children will eat when they are hungry. They regulate what they need. So letting go. If your child skips a meal, it is okay. You are not starving them. They will eat when they need to eat.